Good morning. Keegan here talking more about AI in healthcare, this time AI in primary care. This will be my third video on AI in healthcare. It's been a few months. Anyway, going to talk more about primary care today and ambient AI to support documentation. Cutting through the noise, what is the actual experience for this? We'll talk more about that. Everyone agrees that the practice of medicine is a burden. In fact, running Acuitas Healthcare and in other experiences at an electronic health record company, and even today in some of my work, I get to see and hear about how hard it is to practice medicine. Everyone agrees that practicing medicine today, especially in primary care, is a burden, like I said. But what does the role of AI look like when you focus on alleviating that burden? And what is it? What are the things that really get to people that cause them to say it's the business of healthcare, anything that gets in the way of practicing medicine? What are these things? Every few weeks, I have a conversation with a clinician that wants to get out of the practice of medicine. Actually, it's painful. My background and initial training is in public health, and in particular, healthcare delivery as it relates to its role in public health. And so it's discouraging when I see good physicians want to leave practice, or not to leave practice, but want to get out of shepherding their business. And they talk about this burden, things like managing denials from insurance companies, poor reimbursement, the time it takes to document that results in them spending time outside of visits that they don't get paid extra for, either at home or in the office or at lunch, on the weekend, when they're not on call, and when they're on call. A lack of negotiating power to get higher rates, the rising costs of running a business, which is across the board, but to them it's more about the cost of infrastructure, recruiting, salaries, retention. All these things seem to cost more and more money and makes it harder for smaller, less capital intensive businesses to survive. And so they look at options, selling, joining a larger group, or kind of closing up their practice altogether. I was working on, what's encouraging is this idea of using AI to create a protective bubble. And I need to come up with a better word or better phrase, but put a bubble around the practice of medicine. And what does that mean? So 8 years ago, I was working on this problem, specifically exploring ways to help inform independent practice of medicine when something bad happens to their patient, and in particular, when their patient goes to the hospital, right? You could be the best primary care doctor or nurse practitioner or PA on the planet and still not know when your patient, or find out after the fact that they've been admitted to the hospital. Hospitals electronically have data that their systems create, discharge data, admission, discharge, and transfer data. And when you can capture that and use it in some way to alert primary care that something is going on with their patient, all of a sudden they have more information than they would if that patient was just seeing them once a year or once a month or twice a year. Those are kind of snapshots in time. But if you can tell them, by the way, Joe just got admitted to the hospital, you may want to follow up and see what's going on with him. That's useful. And so we were working on this problem where we were combining electronic medical record data with zip code data and other information to expose and predict the likelihood that someone would be readmitted to the hospital to help prepare for those events. So often in primary care, it's not just about getting real-time information. It's about what happens, what could happen in the future, and preparing for that, especially if there's an upcoming visit or there hasn't been a visit in a while. We were working on that problem. That was 8 years ago. Today, things like ambient documentation using large language models in an ambient document listening sense in the visit, attempting to reduce some of that extra documentation time, pajama time, right? If you read the news, it's digital scribes are going to solve everyone's problems, and suddenly it'll be easier to do the business of primary care. Not so true. And I found this throughout my career in working with clinicians. It's very easy to go into a dark room and pretend that all the things that a doctor needs expressed in software, and it'll be great. It's not great. You need to stay connected and super connected on a daily basis to what's happening in practice to make good supportive software. Anyway, I stay close to my clinical colleagues and their practice experiences for this reason. Everything I do that. In fact, I keep thinking about, and actually should at some point launch an experience group of clinicians to facilitate their sharing and learning when they're using these tools, because every day there are new people learning and new experiences, and adoption isn't near what the news would lead you to think it is. Anyway, when you read the news, things like AI will replace doctors, ambient documentation, digital scribes will do this, and they'll complete the note for you. It's not actually true. What's actually true, if you ask them, especially the new learners, and even folks that have been using it a while, is that in primary care, these tools are useful for parts of the note, not the whole thing. And they still have work to do. And this is the important aspect of AI in healthcare, is that for a long time, and probably forever, having humans in the loop, having clinicians, people in the loop is very important. So what does it do? What does ambient documentation do? What does it help with? There are sections of the note. So like history of present illness, HPI, the assessment, the plan. These are things that ambient documentation is really good at supplementing. Again, it's not going to completely do it for you, but there are other aspects of the note that it doesn't do a great job with, like review of systems. And what you need to do is review the AI output, just like you would the output of a scribe, to make sure that it reflects what happened and is accurate, because this documentation is going to be used to support medical claims, it's going to be used in audit, it's going to be used in a lot of ways. So you still need to make sure. And actually, interestingly enough, if you read the contract with these software companies, there is a limit to liability. And so you really, and that's a whole nother governance conversation, but still, it's really important to have humans, people in the loop there. And there are still a bunch of manual copy, paste, edit actions you need to take, even for electronic health record integrated ambient documentation. And without practice and training, you can very easily or accidentally blend encounters. So, long way of saying, no, it's not going to replace a clinician. There's still plenty of work to do. Can it help? Yes. How much? That remains to be seen, but the folks that you talk to will tell you, yes, it helps me. It makes my day less burdensome, and everything I talked about, continuing to work on everything I talked about will make it even more beneficial. So this gets me wondering, when designed with clinical input from practicing clinicians, what are all the ways that we could use AI to build a protective bubble around primary care? Effectively, could we make the business of healthcare more manageable, such that doctors no longer want to leave the management of healthcare and providing the good care that they're providing today? Could we make the business of healthcare more attractive, especially for independent primary care, and make all of that something to aspire to? No question, there's a lot of potential for AI. There's also a lot of room for refinement in other applications to this end. So anyway, thank you for listening. We'll talk again soon. Take care.